Hi, my name is Riddhish. Welcome to this presentation titled Disparities in Health Literacy Among Australian Men. It is a secondary analysis of the national longitudinal study done on male health, which is 10 to men study. So let's understand what is health literacy. Health literacy is defined as ability of individuals to gain access to, understand, and use information in ways that promote and maintain good health for themselves, their families, and their communities. The health literacy has many significances for the health care, health promotion, and health education. Unfortunately, research has shown that Australian men have a poor health literacy and they are more likely to engage in the risky behaviors and delay seeking medical care, and overall they can have a poor health outcomes. There are multiple factors contributing to these disparities, including socioeconomic status, education level, and often the access to healthcare services. It is often noticed that men from the lower socioeconomic backgrounds or with the lower level of education, they have limited access to healthcare services and they have lower levels of health literacy. Additionally, cultural beliefs and gender norms may discourage men to seek out help whenever required and discussing their health concerns openly. According to Australian Bureau of Statistics, there was a low health literacy prevalence of 60% among Australian adults, and that raised concerns regarding the proper maintenance of health as well as engagement with the healthcare services. 59% of adults between the age of 17 and 74 years of age had a low health literacy, and they find it difficult to understand and apply the knowledge in their daily lives. And there are limited studies done on in this field. Most of the studies focus on women, and that's where my research project fits in. Project aim is to examine the variations of the differences in health literacy among Australian men, and the objective would be to conduct the comprehensive assessment of the current health literacy levels among Australian men, including identifying key factors contributing to disparities. So 10 to men will be the data source for this project. Current version of the wave 4 data will be examined. Sample size will be 7,050 Australian men aged between 18 and 65 years of age. Dependent variables such as health literacy scores are identified using health literacy questionnaires, and independent variables such as socioeconomic status, healthcare access, and health behaviors will be considered. Along with that, SPSS software will be used to estimate the regression coefficients of regression. Data analysis will be done using descriptive type of quantitative study, and linear regression will be run to identify the groups of men having low health literacy in Australia. This table displays the research project timeline. The literature review and data collection has already been done, so data analysis will take place in the month of March and April, followed by write-up in May and publication in June. Thank you for your time today.